Starting with the CNS now. Now CNS has got multiple chapters like anesthetics are there, then sedatives, hypnotics, Parkinsonism, Alzheimer's, dementia, antipsychotics, antimaniacs, antidepressant, anti-anxiety, opioids, drugs of dependence, alcohol. So all these drugs, all these MCQs are here. Now this is a PDF containing at least 720 MCQs, and I'll be uploading both the MCQ PDF, one with answers highlighted and one without answers highlighted, so you can practice all of them. So let's start. Which of the following is not a characteristic of general anesthesia? So not a characteristic. Analgesia, amnesia, muscle rigidity, loss of consciousness. So analgesia, amnesia and loss of consciousness is a characteristic. Muscle rigidity is not a characteristic. So this is the right answer. What is the mechanism of action of most inhalational anesthetics? Inhalational anesthetics like isoflurane, sevoflurane, they actually cause GABA receptor agonism. They potentiate the activity of GABA A receptor, so that causes sedation and unconsciousness. During induction of anesthesia in a young male, the patient begins exhibiting irregular breathing, excitement, and muscle rigidity. So, which stage? So, this is the stage 2. Stage 2 is also called as the stage of delirium, and it involves irregular breathing and increased muscle tone and potential excitement. A 35-year-old asthmatic patient undergoing surgery requires a general anesthetic. Which agent is most suitable for this patient to avoid exacerbating bronchospasm? So now a patient asthmatic है, asthmatic patient में कौन सा agent is most suitable to avoid the bronchospasm? Isoflurane, desflurane, halothane, propofol. Out of this, halothane is a bronchodilator, and it also suppresses the airway reflexes, so it is ideal for asthmatic patients. And anesthetics potency is being discussed in the operating room. The anesthesiologist states that the oil gas partition coefficient of particular anesthetic is high. So what does this indicate about the anesthetic? Now the oil gas partition coefficient of a particular anesthetic is high. This indicates the potency of the anesthetic. This correlates with the potential, and this is mainly about the inhalational anesthetics. So high coefficient means high potency, right? So this is this. A trauma patient in the emergency department requires immediate analgesia and anesthesia for a short procedure. Ketamine is chosen. So what is the mechanism of ketamine? Ketamine is a drug which causes inhibition of NMDA receptors. A 25-year-old male undergoing surgery develops a sudden rise in body temperature, muscle rigidity, tachycardia after receiving a volatile anesthetic. So which anesthetic is likely responsible? A sudden rise in body temperature. So this indicates malignant hypothermia, and so this is halothane, and this is because of abnormal calcium release in the skeletal muscle. The drug which is used to treat malignant hypothermia is IV dantrolene, which is a ryanodine receptor antagonist. A 30-year-old woman is scheduled for an outpatient endoscopic procedure. So which IV anesthetic is preferred for rapid induction and quick recovery? So outpatient endoscopic procedure, the drug of choice is propofol. This is also day care जो procedures होते हैं, it is very useful in them. A patient undergoing surgery with desflurane is noted to have rapid induction and emergence from anesthesia. So what property of desflurane accounts for this? The desflurane, patient undergoing surgery with desflurane having rapid induction and emergence from anesthesia, this is because of the low blood solubility, and as a result the patient is recovering quickly. Coming to sedative hypnotics, which of the following drugs is commonly used as sedative hypnotic in the treatment of insomnia? So the drug which is commonly used is zolpidem. This is a non-benzodiazepine hypnotic, and it is used to treat insomnia due to its sedative property and rapid onset of action. Which of the following is the main mechanism of action of benzodiazepine? Benzodiazepines are GABA A receptor agonist. Which is a characteristic of benzodiazepine overdose? Benzodiazepines overdose can lead to CNS depression. So that it is the chief complain of poisoning. Which drug is considered as the treatment of choice for benzodiazepine overdose? Flumazenil is the benzodiazepine antagonist, and it is used to reverse the sedative effect of benzodiazepine overdose. Which is a feature of barbiturate that makes them less commonly used today? Barbiturates high therapeutic index? No, this is wrong. They have a very narrow therapeutic index. Mild sedation? No, they cause good sedation. And limited CNS? No, they have a good CNS penetration. So the answer here is high potential for abuse. So these barbiturates have got a very high potential for abuse. Which sedative hypnotic is commonly used as anxiolytic as well as hypnotic? Midazolam. Midazolam, out of these options, midazolam is used as anxiolytic as well as hypnotic. Which is a non-benzodiazepine hypnotic used to treat insomnia? Non-benzodiazepine in सब में we have Zaliplon. Which of the following medications is primarily used in management of sleep disorders but does not affect the GABA A receptors? So the drug which does not affect the GABA A receptors but is used in sleep is Ramelton. It is a melatonin receptor agonist. So melatonin receptor agonist used primarily in the management of sleep disorders. Which of the following benzodiazepines has the shortest half-life? Shortest half-life is midazolam. Which drug is used to treat alcohol withdrawal symptoms? Now, out of these options, we have chlordiazepoxide, which is used to manage the alcohol withdrawal. Okay, so this is alcohol withdrawal के ऊपर बहुत questions पूछे जाते हैं. So this drug prevents seizures and delirium tremens. Coming to the questions on epilepsy, anti-epileptic drugs. What is the primary mechanism of action of phenytoin? Phenytoin basically causes prolongation of inactivated state of sodium ion channel. The voltage gated sodium ion channels को voltage gated sodium channels को it prolongs the inactive state, and thereby it reduces the discharge of action potentials. Which anti-epileptic drug is contraindicated in absent seizures due to potential exacerbation? Now, absent seizures में कौन सी दवाई नहीं दी जाती है? Valproate is given, phenytoin, ethosuximide is given, lamotrigine. So the drug which is not given is phenytoin. Phenytoin can worsen the condition and so avoided in these seizures. What is the therapeutic range for plasma concentration of phenytoin? It is 10 to 20 microgram per liter. To avoid toxicity, इससे ऊपर जाएगा तो then it can result in toxicity because phenytoin follows zero order kinetics. So please remember this. Which anti-epileptic drug is the first line treatment for absent seizure? Ethosuximide. A 3-year-old child with severe myoclonic epilepsy is most likely to benefit from which adjunctive therapy? Now, in a severe myoclonic epilepsy patient, the drug which is adjunctive therapy के रूप में दिया जाता है, that is stiripentol. Now, stiripentol is approved when used with clobazam. It is not given alone, clobazam plus valproate. This is the therapy for Dravet syndrome. Which drug is preferred for emergency treatment of status epilepticus? Status epilepticus में lorazepam is preferred because it has a longer duration of action out of these due to slower redistribution. What is the adverse effect associated commonly with chronic phenytoin? Now, chronic phenytoin causes gum hypertrophy. Which of the following drugs is primarily used for febrile seizures in children? We use rectal diazepam in febrile seizures. Which anti-epileptic drug acts by inhibiting the GABA transporter? GABA transporter को inhibit करता है tiagabine. Tiagabine inhibits the GABA uptake. It reduces the GABA uptake into the neurons and glial cells by blocking the blocks the GABA transporter. That is GABA transporter. ठीक है, so it increases the synaptic GABA. What is a serious adverse effect of valproate in children? Valproate can cause fulminant hepatitis. It is a rare but serious adverse effects of valproate, particularly in children under 3 years of age. What is the primary neurotransmitter deficiency in Parkinson's disease? We know that it is dopamine. Very simple question. Dopamine, there's a degeneration of dopaminergic neurons in the substantia nigra pars compacta, leading to dopamine deficiency in the striatum, and there is an imbalance between dopamine and acetylcholine. So dopamine is inhibitory, right, and acetylcholine is excitatory, and it results in the motor symptoms. Levodopa is combined with carbidopa because carbidopa allows more levodopa to cross the blood-brain barrier. Carbidopa inhibits the dopa decarboxylase enzyme. Okay, and this reduces the breakdown of levodopa outside the brain. So this increases the amount of levodopa available to cross the blood-brain barrier. Which of the following drugs is an irreversible MAO-B inhibitor used in Parkinson's disease? Irreversible MAO-B inhibitor which is used is selegiline. Selegiline selectively and irreversibly inhibits MAO-B enzyme, and this metabolizes dopamine in the brain. So it prolongs the dopamine in the brain and reduces the Parkinson's symptoms. The primary site of action for levodopa is striatum. Striatum में जाके act करता है. So this is the primary site of action of levodopa. Which drug is primarily used for drug-induced Parkinsonism? Drug-induced Parkinsonism, which is mainly caused by antipsychotics, which are basically dopamine antagonist. So there it responds very well to anticholinergics. So there anticholinergics are given, and in that we have trihexyphenidyl, which reduces the excessive cholinergic activity. Amantadine acts by blocking the NMDA receptor. Amantadine is actually an antiviral drug, so it is used in influenza, but here in dopamine Parkinsonism also it is found to be effective, which is not a side effect of levodopa. Levodopa causes nausea, causes dyskinesia, hallucinations. It does not cause hypertension. It does not cause, it basically causes postural hypotension. So it does not cause hypertension. Then rasagiline differs from selegiline because it is less potent, it does not produce amphetamine metabolites, it acts on both MAO and MAO-B, it causes more postural hypotension. So it does not produce amphetamine metabolites. Rasagiline is not metabolized to amphetamine derivatives unlike selegiline. Donepezil is used in Alzheimer's disease because donepezil is an anticholinesterase. So its activity, it selectively inhibits acetylcholine esterase. Which drug can alleviate the on-off phenomenon in Parkinson's? The on-off phenomenon in Parkinson's can be alleviated by entacapone, which is a COMT inhibitor, and this drug COMT inhibitor, it extends the half-life of levodopa, so smoothens out the fluctuations known as the on-off phenomenon. The distinctive action of chlorpromazine-like drugs not possessed by any other class of drugs. What is the distinctive action of chlorpromazine? Now this is an antipsychotic, antipsychotics है ये. So it relieves anxiety without producing sedation, suppression of aggressive behavior, mood elevation in depressed patients, and correction of distortion of thought and perception occurring in the psychosis. सो क्लोरप्रोमाजीन ड्रग में क्या एक्शन है जो दूसरी ड्रग में नहीं होती है? क्लोरप्रोमाजीन में ये वाला एक्शन होता है कि ये करेक्ट करता है डिस्टॉर्शन ऑफ थॉट परसेप्शंस ऑकरिंग इन साइकोसिस. दिस इज एन एंटीसाइकोटिक ड्रग. इट ब्लॉक्स द D2 रिसेप्टर्स इन द लिम्बिक सिस्टम. जो हमारा लिम्बिक सिस्टम है उसमें D2 रिसेप्टर्स को ब्लॉक करता है. So this action corrects the distortion of thought and perception which is seen in psychosis like delusions and hallucinations. Actions of chlorpromazine include the following except. Chlorpromazine के actions ये सब हैं except indifference to external stimuli, postural hypertension, hypothermia and hypoprolactinemia. So chlorpromazine actually it increases the prolactin release. ठीक है, क्योंकि डोपामिन जो प्रोलैक्टिन release inhibitory hormone is actually dopamine. Now when antipsychotic is given they will reduce this dopamine. So dopamine reduce होते ही PRIH कम होगा, so there will be increased prolactin. So there is in fact hyperprolactinemia. So when they are asking except, so the answer is this. Flufenazine differs from chlorpromazine in the following respect, except. Again, question is except. Flufenazine और chlorpromazine में ये differences हैं. It has higher antipsychotic efficacy. It is less sedative, less likely to produce seizures, causes more prominent extrapyramidal side effects. Flufenazine is a high potency antipsychotic, differs from chlorpromazine by being less sedative, less likely to cause seizures, and more prone to cause extrapyramidal side effects. It does not have a antipsychotic efficacy as all antipsychotics. So this is the right answer here. Which of the following is a long-acting neuroleptic having specific antidopaminergic action but little adrenergic or cholinergic blocking activity? So a long-acting neuroleptic having specific antidopaminergic action but little adrenergic or cholinergic blocking activity out of triflupromazine, thyroidazine, clozapine. Clozapine or in सब में the answer here is pimozide. It is a long-acting neuroleptic drug and it has got strong dopamine receptor blocking activity. It has got very minimum adrenergic or cholinergic activity. So this is good for maintenance therapy in psychotic conditions, especially patients who are non-compliant with medications. The major limitation in the use of clozapine for treatment of schizophrenia is its potential to cause agranulocytosis. Clozapine is very effective, is highly effective in refractory schizophrenia, or what you call as resistant, in improving both negative and positive symptoms. However, its risk is limited due to the risk of agranulocytosis. What is true for risperidone? What is true for risperidone? Risperidone is an atypical neuroleptic, right? It has combined D2 5-HT2 receptor. It does not cause hyperprolactinemia. So here the answer is both A and B are correct. It is an atypical neuroleptic and it has got dual actions, serotonin as well as dopaminergic blocker होता है, and it definitely elevates prolactin levels, which makes the option C incorrect. Which of the following is a high potency antipsychotic drug having minimal sedative and autonomic effect and no propensity to cause weight gain? Out of this option, chlorpromazine, triflupromazine, haloperidol and olanzapine. So the drug which is a high potency antipsychotic drug with minimum sedative autonomic effects and no weight gain here is haloperidol. It is a high potency antipsychotic, minimum sedation, negligible weight gain. It is used in acute psychosis and it is also used in Gilles-de la Tourette syndrome. Clozapine is considered to be an atypical neuroleptic because it has weak antidopaminergic action but high antipsychotic efficacy. Its side effect profile is different from chlorpromazine. It is not a phenothiazine derivative. So this clozapine is atypical because it has got weak. So this correct होता है. It has fewer extrapyramidal side effects. Side effect profile is not similar to that of typical antipsychotic. So the options A and B are correct. Phenothiazine therapy associated with sudden onset of high-grade fever, muscle rigidity and altered sensorium could be because of neuroleptic malignant syndrome. Malignant hypothermia anesthetics करते हैं, tardive dyskinesia akathisia में fever नहीं आता है. Fever comes in neuroleptic malignant syndrome. So here the drug has to be stopped immediately and start with symptomatic management. Which adverse effect of neuroleptic drug is positively correlated to antipsychotic potency? The extrapyramidal motor disturbances. More blockade of dopamine receptors will result in more EPS. So this is seen in high potency neuroleptics more, like haloperidol, as compared to low potency agents. A psychiatrist is evaluating several patients with different anxiety related conditions and is considering treatment options. मतलब यहाँ पे patient को anxiety, SSRIs are known to be effective in a range of anxiety disorders. In which of the following scenarios would SSRIs not be considered the drug of choice? SSRI किस केस में drug of choice नहीं होंगे? So now here we have panic attack, social phobia, PTSD and generalized anxiety. So in panic attack, the SSRIs are not effective because SSRIs have a very delayed onset of action. They take at least 6 weeks for the complete effect to exert. And acute panic attack में we use BZDs, that is benzodiazepines, which act rapidly. SSRIs are more better for these, where a long-term usage is important. Which of the following is not a disorder associated with anxiety? एंग्जाइटी में GI न्यूरोसिस, OCD, PTSD, डिमेंशिया में एंग्जाइटी नहीं होती है. A 52-year-old patient diagnosed with generalized anxiety disorder started on benzodiazepine. Psychiatrist explains that medication works by modulating specific neurotransmitter. Which mechanism is that? Benzodiazepines enhance, they are GABA agonist. A 52-year-old man with a long history of heavy alcohol use admitted to the hospital with acute alcohol withdrawal. Okay, so this is acute alcohol withdrawal. So benzodiazepine commonly used. Which medication is used here? Alcohol withdrawal mein we use chlordiazepoxide. A 60-year-old woman taking diazepam for the past 5 years to manage her generalized anxiety disorder. Initially, medication was effective, but over time she noticed diminishing effects and required higher doses to achieve the same level of symptom relief. Recently, she also experienced increasing drowsiness and confusion and difficulty in coordination. So, which long-term adverse effect of diazepam is most likely responsible? Now, diazepam जब लंबे समय तक लेते हैं तो फिर इसकी एफिकेसी कम हो जाती है, डिपेंडेंस टॉलरेंस डेवलप हो जाती है, लीडिंग टू कॉग्निटिव इम्पेयरमेंट एंड साइकोमोटर स्लोइंग. A 28-year-old man arrives in emergency with complaint of palpitation, sweating. Symptoms started an hour ago, which explains why SSRIs are not recommended for acute, because SSRIs have a delayed action, takes several weeks to exert their effect. A 40-year-old woman with GAD has been experiencing chronic anxiety and tension. इसने medication लिया, anti-anxiety drugs can cause dependence and withdrawal. Now medication नहीं लिया इसलिए psychiatrist decides to prescribe an azapirone. Now, what is the advantage of azapirone? Azapirons have a lower risk of dependence and they do not cause significant sedation also. A 35-year-old woman with generalized anxiety is prescribed buspirone. Then, which of the following is the starting dose of buspirone? Buspirone is started at 5 to 15 milligram once to thrice daily. Which of the following is not the choice of drug in the maintenance therapy of panic attacks? Hydroxyzine is an antihistaminic. This is an antihistaminic and it has got sedative and anxiolytic property, but it is not typically used for maintenance therapy of panic attacks. A 38-year-old woman with a diagnosis of panic disorder has been on SSRI therapy for several months. She is experiencing intolerable side effects. So, which of the following medication is an alternative to SSRI? Here, alternative to SSRI, here she can take this drug valproate, buspirone, propranolol, इसमें से mirtazapine. It is a non-adrenergic and specific serotonergic antidepressant, effective in treating panic disorders, and is often used as an alternative to SSRI. Which opioid receptor is primarily associated with endogenous opioid peptides known as endorphins? The main opioid receptor is mu opioid receptor. Endorphins, typically beta endorphin, it is endogenous opioid peptide derived from pro-opiomelanocortin, and they have the highest affinity for the mu receptor. And this is mainly responsible for the analgesic action and also contributes to the euphoric and respiratory depression and dependence, right? So the main receptor is mu. A 45-year-old male with chronic back pain prescribed morphine for pain management. Which of the following side effects is most likely associated with activation of mu receptor? Mu opioid receptor के साथ सबसे पहला होता है respiratory depression and constipation. So this is the side effect metabolized by mu receptor. A 28-year-old woman with a history of epilepsy evaluated for chronic pain management. Her physician is concerned about the potential for opioid-induced seizures. Which opioid receptor subtype associated with pro-convulsant action? That is, the physician is worried about. This is here delta receptor. Opioid-induced seizures. This is involved. The delta receptor is involved in the anticonvulsant property of the opioids. So activation will lower the seizure threshold. A 35-year-old male presents to the clinic with severe lower back pain, history of substance abuse. Physician wants to prescribe an opioid that minimizes the risk of euphoria and addiction. Which opioid receptor is characterized by high affinity for ketocyclazocin and mediates primarily spinal analgesia, making it a suitable target for minimizing the risk of euphoria and addiction. So now kappa receptor has a very high affinity with ketocyclazocin, and it mediates the spinal analgesia without significant activation of the reward pathways. So this KOR agonist they produce analgesia with reduced risk of euphoria and addiction. A 50-year-old man with chronic pain prescribed opioid. Now he reports severe constipation and mild respiratory depression. So the receptor involved is opioid receptor, mu opioid. A 45-year-old male with severe chronic pain is prescribed hydromorphone, which is true regarding hydromorphone. Hydromorphone is a semi-synthetic opioid metabolized to hydromorphone 3 glucuronide in the liver. A patient with advanced Parkinson's disease experiences severe off episode characterized by hypomobility. Which semi-synthetic opioid derivative manages these symptoms? It is apomorphine. So these are some questions on the opioid. Some questions on alcohol drug dependence. A 35-year-old male presents to clinic after consuming significant amount of alcohol, complains of nausea, fatigue, confusion. He reports consuming alcohol on empty stomach. Which statement is true? Now we know that alcohol is primarily absorbed in the stomach and reaches peak blood level in 60 minutes. Ethanol is mainly metabolized by cytochrome P450-3A4. Chronic ethanol consumption induces CYP2E1, which increases clearance of substrate and susceptibility to toxins. Yet this is the right answer. It leads to induction of CYP2E1, and this increases metabolism of ethanol and other drugs also, and it produces a lot of toxic metabolites. A 42-year-old man presents to the emergency department with severe headache, dizziness, confusion, and visual disturbances. He admits to consuming a substantial amount of homemade alcohol the previous night. Lab tests reveal metabolic acidosis with increased anion gap. So, which of the following treatment is most appropriate? So, now patient is having severe headache, dizziness, confusion, visual disturbances. So, this indicates that there was a methyl alcohol पॉइजनिंग. सो मिथाइल अल्कोहल क्योंकि उसने होममेड अल्कोहल लिया. सो यहाँ पे इसका हमारे पास एक एंटीडोट है, दैट इज़ फोमेपिजोल, एंड इंट्रावीनस फोमेपिजोल इज़ द फर्स्ट लाइन ट्रीटमेंट combined with the soda bicarb to manage the acidosis. Now, a 32-year-old pregnant woman, history of heavy drinking, concerned about effects of alcohol on unborn child. Which statement describes fetal alcohol spectrum disorders? Children with fetal typically exhibit craniofacial abnormalities, CNS dysfunction, and growth deficiencies. That is there. A 45-year-old male presents to the emergency with altered mental status and history of ingesting antifreeze. Lab tests reveal high anion gap metabolic acidosis. The appropriate treatment for this patient. Now here, the administration of ethanol. Ethylene, the patient is having ethylene glycol poisoning. From antifreeze injection, it causes metabolic acidosis and to the toxic metabolites. So ethanol is given. Ethanol will compete with ethylene glycol for alcohol dehydrogenase and prevent the formation of the toxic metabolite. You can also give fomepizole here if it is available. A 38-year-old female with history of chronic alcohol use presents to psychiatry with symptoms of depression, anxiety. She also reports experiencing frequent social and medical issues. Which psychiatric condition is associated? It is OCD. Attention deficit तो नहीं होगा, schizophrenia नहीं है, autism नहीं है. Chronic alcohol use is usually associated with psychiatric comorbidities like depression, anxiety, and OCD. A 45-year-old male with a history of alcohol use disorder, abstinent for 14 days, motivated to continue the sobriety. He expresses a desire to use a medication to help maintain his abstinence. So which medication is FDA approved here? Acamprosate. Acamprosate is FDA approved for alcohol abstinence. For maintaining the alcohol abstinence, acamprosate is the FDA approved drug. It works by basically it modulates the glutamatergic state of the abstinent brain, so reduces the cravings and likelihood of relapse. A 50-year-old female with alcohol use disorder tried disulfiram without success. So which is the not FDA approved for AUD but has shown promise in reducing alcohol consumption? that is gabapentin. Acamprosate is FDA approved. Baclofen, nalmefene not. So this gabapentin, although not FDA approved, but it has shown potential in reducing the alcohol consumption. So this is also a good drug. So these were some questions on alcohol and drug dependence. Now see, there are 719 questions here total. So I'll be uploading both the PDF and have a good exercise on CNS. There are a lot of questions and a lot of very important questions.